Welcome back to DBL. We've got our very own Dr. Coley joining us. We're so grateful to have her here because we just talked about everything COVID, Dr. Fauci in the last segment. So Dr. Fauci, Dr. Coley testified yesterday on Capitol Hill, and he revealed the recommendations on social distancing had not been studied. He was also grilled about requiring kids in schools to wear masks. So Dr. Coley, looking back, what would you say to the people who said, well, this was never studied, and criticizing Dr. Fauci? What would you say as a Harvard, MIT doctor?
You know, we have had decades, in fact, centuries of data on social distancing. It dates all the way back to the 14th century when the boats came from Venice and it was the beginning of the Black Death. Then we saw it again during smallpox. We saw it again during the bubonic plague. Because when you have an infectious disease outbreak that spreads from person-to-person contact, what do? You separate the people. It's common sense. And
even in your own household, right?
Yes.
If Sophie has a cold, I go in a different room.
Right. And it's based on scientific principles because when you're talking, when you're breathing, you give off respiratory droplets. Now, we thought that this virus spreads only by respiratory droplets, and that's why the 6 feet would work, but it actually also lingers in the air through aerosols, and that's why we started getting criticized for it later. But if you look at mathematical models, guys, we prevented 800,000 American deaths with social distancing and reduced transmission by 65%. That's something you can't argue with.
Yeah. So, you know, going back to the first conversation we had, I do have some questions, right, about how they handled that. And one of them was kids wearing masks in schools and people just generally wearing masks outside because you were shamed if you didn't wear that mask or even thought that it might not work. What is your take on that, looking back now? Because I did follow all the rules.
Maybe outside wasn't necessary, right? Because you have a lot of ventilation. But in schools, especially for young kids, we know that high quality masks that fit your face, that are N95 or KN95, do prevent aerosol transmission and respiratory droplet transmission, and they're effective. In fact, they compared schools that had optional masking to ones that had mandatory masking, and there were 72% less infections with the mandatory masking. So we know that masks worked. But here's the problem when people say there's no evidence. How do you study kids during a pandemic? In fact, you guys are both parents. Would you put your kids into a clinical trial during the midst of a pandemic, knowing that the only thing we don't have vaccines, we don't have treatments.
No,
the only thing
I would never put their life in danger.
Right?
I would not.
Right. So we have to rely on scientific principles in those types of situations. And I think it was not overkill to use every tool in our toolbox to protect the most vulnerable population, the most valuable population that we have, which is our children.
So looking back at the pandemic from your lens, obviously there are things that we could have done differently. What do you think it was the biggest mistake?
Oh, this is a tough one. I would say there are probably two mistakes that happened. So the first is, I think when Dr. Fauci early in the pandemic said that masks don't work. Now, why did he say that? There was a lack of PPE, personal protective equipment, for healthcare workers. So he said, don't everybody run out and buy the masks because there's a shortage. We need to save it for the hospital systems. But had he been more clear in that, I think that would have been helpful. And the second, which I think we're still struggling with, is the misinformation wasn't penalized. People weren't taken to jail.
They weren't checked.
Yes. Yeah. If you're drunk driving, you get taken to jail when there's misinformation, right? And here's what happened in the pandemic. People just listened to any Joe Blow that had a platform that got up there and said whatever he wanted. Now, let's say you're on an airplane and the plane is going down. Who are you going to listen to? The captain and the crew or the guy sitting next to you?
Pilot.
Right? And that's what we should have done here. We should have listened to our Dr. Fauci's, who's been around for decades, who has the experience, who has the expertise, rather than somebody with a microphone talking out of their expertise about something they don't know anything about.
Thank you so much, Dr. Coley. You can follow Dr. Coley on social media at Pyle Coley MD. Also, be sure to subscribe to her YouTube page, plus check out her podcast, Heart of Medicine, wherever you listen to your podcasts. Thank you again, Doctor. We appreciate you. We'll be right back.